Definitely excited. So many folks are willing to take some time in the middle of the workday to join us for what I think is an absolutely critically important topic. So, again, for those of you that haven't heard, my name's Phil Verhoef. I'm the president of Physicians for a National Health Program. I'm based down in Honolulu, Hawaii. I'm an ICU physician here, and I take care of both critically ill kids and adults. But more importantly, I'm part of the leadership of this organization, and we're gathering here today because one of the biggest dangers that we as doctors see in healthcare are all these for-profit insurance corporations. And honestly, this is a significant part of why we advocate for improved Medicare for all as the best solution to make sure everyone in this country has the healthcare that they deserve. And I think it's really important to remember that in Medicare, insurance corporations are acting through the Medicare Advantage programs. And so that's our target for today. And these Medicare Advantage programs, they hurt seniors because they deny care, they delay care, they make it harder for seniors to access care. But they also hurt doctors by restricting the care that we can provide for our patients. In addition, they hurt hospitals. And the consequence of this is that more and more hospitals are just pulling out of Medicare Advantage. They're saying, you know what? We're not going to accept Medicare Advantage as a payer for your care when you need to go to the hospital. So that's a really ominous, scary development here, right? And honestly, these corporations hurt Medicare itself because they overcharge our Medicare system to the tune of up to $140 billion. That's billion with a B, $140 billion a year. That's taking money, pocketing it as a profit instead of using it to provide health care. So we're going to hear today about how insurance corporations overcharge Medicare Advantage, and we're going to hear testimony from patients and doctors. We'll also hear from Representative Pramila Jayapal. She's one of our strongest advocates. She's going to give us the perspective from Washington, D.C. And most importantly, we will talk about how we can take action to protect Medicare. We'd like to give special thanks to the Center for Medicare Advocacy. This is a great ally of ours, and they're going to be responding in the question and answer function. So if you look in the bottom of the Zoom screen, you'll see the Q&A button. That will allow you to ask questions of us, and we'll do our best as we can to get to some of those questions and answer them. But one question you don't have to answer, is we will be recording this. We'll be able to send this out to all of you. So as long as you've joined, you will get an email tomorrow with both the recording and all the links that you see here today. So we will take care of that. And one last reminder, we'd like you to put your name, your location in the chat and put in one thing you want to improve about Medicare and Medicare Advantage. We'll be closing that chat up shortly. I can see we've got over 200 messages now in the chat, which is awesome. Thank you all for participating. So let's get started with Dr. Ed Weisbart. He is our National Board Secretary and a real leader in our policy development side of things. And he's going to explain how insurance corporations are overcharging Medicare Advantage, as well as some of the other dangers that these companies pose. Ed, I'm going to turn it to you.
Hey, thanks, Phil. And I'm just so glad to see all these folks here watching this. And I know that there will be more coming up too. So delighted to have you here. We started looking at how much Medicare Advantage is pilfering the national treasury and found that nobody had actually added all the numbers together. So we produced this report that Phil mentioned that we've published a few days ago. We did it because there are tons of studies out there that have done deep dives into individual ways that insurance companies, that the Medicare Advantage companies are being over rewarded. But we hadn't seen anybody put a context around it and put it all together. So we reviewed plenty of studies over the last several months and found this sort of good summary that actually Medicare Advantage doesn't do what they claim they do of saving money, actually the opposite. But we wanted to put more of a solid number on that and put a context about it, because the context turns out to be really important. So if you want to kind of do a deeper dive into this, I recommend you look at the report, but I want to walk you through the four biggest areas. The first way is that Medicare Advantage firms are paid as if they were taking average patients in Medicare, but we know that they're actually attracting much healthier patients who cost less money than the average person does. And that adds up to roughly $50 billion a year, just that one piece. We also know that they have this skill at upcoding, which means basically finding ways to add diagnoses to patients' charts so that they can pretend that these people are sicker, whereas these are diagnoses that the physicians didn't feel the need to enter on the chart because they're not of real clinical value. That's the one that's gotten the most attention. It's called upcoding, and it's a relatively small one. So you see where we're heading with this. It's a big number coming up. Then there's a whole series of benchmarks and bonuses that we won't unpack today, but the report goes through how we're really there's very little evidence that these things add any value and that they're probably misplaced. And that's another 25 billion or so. If you add up just those relatively non-controversial factors, you get anywhere from 88 to 104 billion dollars, depending on which number you choose. But then if you add in this additional factor called induced utilization, it's a terrible phrase, but this is basically we're paying Medicare Advantage plans as if Medicare Advantage removed financial barriers to care. That's what people get when they purchase Medigap in traditional Medicare. And we're paying the Medicare Advantage companies as if they're doing that, but they're not doing that. The financial barriers in Medicare Advantage are still rather huge for many people. And so that's another $36 billion. So the range goes up to $140 billion a year. You know, which is that a big number when you're talking about federal budgets? Is it a little number? Is Neptune closer than Pluto? It's hard to think in these numbers. So we're going to give you the context to think about it. So I quoted you a range. The lowest estimate was $88 billion a year, and maybe as high as $140 billion. I happen to think that $140 billion is conservative. These are all the legal ways that they're overpaid. This doesn't even begin to look at anything like fraud. This is just the legal ways. So I think that 140 is frankly a conservative number, but there's a range, 88 to 140 billion dollars a year. The most shocking thing to me is that we went and found reports from CMS that add up the total dollar amount of Part B premiums that people in Medicare pay. So seniors and people with disabilities, as you know, have to pay on average about $165 a month to have access to Medicare Part B, which is the part of Medicare that pays for outpatient care. So if you add up that $165 that invisibly disappears from our Social Security checks usually, if you add that up across everybody in Medicare who's paying that, which is almost everybody, that's $131 billion. So is that a lot? $131 billion. Yeah, it's a lot. It's a lot. So we think, you know, I pay that. I pay my premium. We think that we're paying that premium because that's the only way that the government can afford to provide us with Medicare Part B. But in reality, that money and more is going directly into the profit and overhead and overpayments, basically, for the Medicare Advantage corporations. That's not the way it should be. We don't need to do that. Medicare Part D, the drug benefit, highly controversial when it was being enacted. The federal government spends $126 billion on that, less than we throw away to the Medicare Advantage farms. One of the improvements that a lot of us would like to see in traditional Medicare would be to put in a limit, an out-of-pocket maximum that you could spend if you were in traditional Medicare. I'd like to see that number be zero, but here's an estimate done by the Urban Institute looking at what if we put in a $5,000 out-of-pocket maximum in traditional Medicare. That would cost $39 billion, a fraction of what we're spending on Medicare Advantage without any value. So we could absolutely afford to put in a greatly reduced financial risk in Medicare, in traditional Medicare. And of course, if you did that, then you wouldn't need to have, as many people wouldn't be needing to shop for Medigap and paying those premiums. We also looked at the benefits that are the incredibly popular benefits that are not included in traditional Medicare and for which a frankly pretty inferior version is typically included in Medicare Advantage. And if you add up what it would cost to give a good version of dental, hearing, and vision to everybody in Medicare and Medicaid, it's far less than the amount of money that Medicare Advantage firms are able to pilfer from us. So yeah, the money that should be diverted is a lot of money. And if you look in the chat, I'll bet there's people in there saying right now that they would like to have these benefits added on to traditional Medicare. It's very popular. So the message of this webinar is that we have to protect ourselves, and our patients, and everybody needs to be protected from this profiteering from the Medicare Advantage firms. It's hurting all of us. So Medicare Advantage firms, despite this extra resource that they're taking from us, are notorious for delaying healthcare, denying healthcare, and you're going to hear some stories, very specific stories about how that's incredibly dangerous and often deadly. So we'll be telling you some stories about that today. And they're doing that so that they can have larger profits in their corporations. And this profiteering that they do is taking the money that we should be able to use to reduce what you have to pay in Medicare, to add in hearing and vision dentistry. Their profiteering is taking the very resources that we need and frankly deserve. And they're taking away our freedom, our freedom to choose which physician we want to go to. You go into Medicare Advantage and you give up your freedom of choice of doctor. They give you a much narrower list than the traditional Medicare list. You have a much fewer range of hospitals you can pick from. And as Phil mentioned, that list is getting smaller and smaller. And in theory, they say that it's a market economy, but they're not giving us the information to let us choose. We don't have any public information comparing which Medicare Advantage firms delay care or deny care more than the others, or any of these other problems that we have. That information isn't out there. It is not a market. They're hiding the information that we need. So our key message here is that we need to protect Medicare. We need to reclaim Medicare from the profiteers and use that money for the resource for the benefits that we know we all need. Phil, back to you.
All right. Thank you, Ed. That was fantastic. And many thanks to PNHP's policy committee for putting that report together. And I think this makes it clear we need to take action to protect patients who are on Medicare Advantage and who are in traditional Medicare. You just heard Ed say that insurance companies are pocketing $140 billion every year. And that would actually be useful to give everyone on Medicare much better care. They're not going to want to let that fat profit go, right? They're going to want to hang on to that in any way that they can. And it will only take a movement of doctors, beneficiaries, and others in order to advocate for the care that everyone deserves. We have to fight. You'll hear more about the action steps later on, but I do want to ask, before the end of this webinar, please sign our petition demanding that Congress and President Biden protect Medicare beneficiaries by cracking down on insurance company abuses and by significantly improving the traditional public Medicare program. In addition, you can fill out our Medicare survey and talk a little bit about your experience with either Medicare or Medicare Advantage, and you can share some of your observations as well as sharing these surveys with everybody that you know. The more people that we can collect data from, the more stories we have to share. In addition to the links that you'll see in the chat, you will find everything you need to know about how to protect Medicare and how to protect Medicare beneficiaries on our website, protectmedicare.net. That's all one word, protectmedicare.net. And next, we're going to hear from a couple of doctors about the ways in which Medicare Advantage insurers interfere with the care that they're trying to provide. So here are Dr. Mark Krasnoff and Dr. Diljit Singh providing some testimony for us.
Hi.
I'm sorry, that's Dr. David Mayer, not Dr. Mark Krasnoff. My bad.
Hi, I'm David Mayer, a palliative care physician at the University of Missouri. I want to share some of the challenges with pharmacy denials and prior authorization that we encounter from private insurance companies, including Medicare Disadvantage plans. We've been faced on repeated occasions with patients with advanced cancer being sent home from the hospital on an appropriate long-acting pain medicine as part of a pain treatment plan, who were unable to get it filled when they went to their pharmacy due to insurance restrictions or prior authorization requirements. These patients have often gone for days without appropriate pain medicine. Let me share an example. A 65-year-old woman with widespread pancreatic cancer on chemotherapy was admitted to the hospital with constipation and pain. She had tried multiple laxative medicines with her pain medicine unsuccessfully. In the hospital, the palliative care team changed her to a buprenorphine patch with oxycodone for breakthrough pain. You may not be familiar with the use of buprenorphine for pain. Buprenorphine is best known for treating patients with opioid dependency. However, except in the most severe cases, it's a highly effective medication with an excellent side effect profile, including reduced constipation. The perfect medication for this situation. The woman was doing well in the hospital. However, on discharge, her insurance declined to let her pharmacy fill the buprenorphine patch. She had uncontrolled pain and worsening of her constipation. When she returned to the palliative care clinic, she was furious with the hospital palliative care team for her inability to get the meds she needed. And we were furious that her insurance would not allow her to get the meds she needed to control her pain and constipation. This is a clear example of the devastating impact of Medicare Advantage and other private insurance plans denying people the medication they need. Medicare Advantage plans don't care about the care they provide, they just care about their profits. The fight for stopping Medicare Advantage companies from denying our patients the care they need is a fight for healthcare justice. I could provide other examples with different long-acting opioids, such as OxyContin. We all know there's an opioid use crisis in this country, fostered in part by pharmaceutical companies. But there are still clearly appropriate uses for long-acting opioids, such as in patients with advanced cancer. Medicare Advantage plans and other private insurance plans shouldn't be denying patients the medications they need to control their pain. Hi, I'm David Mayer, a palliative care.
Thanks so much for that powerful testimony, Dr. Mayer. I'm Diljit Singh, Vice President of PNHP, and as a specialist who takes care of women with gynecologic cancers, I also have just too many stories about how Medicare Advantage or disadvantage delay and deny care when patients' lives and the quality of their lives is on the line. To capture some of these stories, we launched a physician survey, and I'm going to just give you guys some of the responses so far from doctors who work with people on Medicare Disadvantage plans. I am a mental health provider, and I have had clients come who believe they have Medicare, and then it turns out they actually have Medicare Advantage, and their plan doesn't cover mental health. Initially, they presented their Medicare card, so I billed that, and the claim was denied. So they either have to stop seeing me, pay out of pocket, or switch to regular Medicare. I have a client right now who I've continued to see, but have not gotten paid for. Another provider. I have a homebound patient that I make house calls to. He desperately needs home physical therapy. We have only one company that delivers home physical therapy in our rural county. However, they don't take his insurance, so he gets nothing. We have to wait till the end of the year so he can try to change his insurance to get the care he needs. Numerous occasions when a patient needed a specific medication to avoid blindness. And through a combination of prior authorizations and inappropriate denials, treatment was either delayed or a less effective drug needed to be used. All of this resulted in more work for me, more hassles for my staff, and unnecessary stress for the patients stuck in the middle who simply want to keep seeing. Under Medicare Advantage, I have had to give a patient a trial of a medication I knew would not work well for her in order to prove it did not work and then get the prior authorization approved for the medication I wanted to prescribe for her in the first place. These stories are infuriating and frustrating, but they are critical that we get the stories together to convince the public and legislators that patients on Medicare Disadvantage plans must be protected from these insurance corporations. We're asking everyone on this call to take action by filling out and sharing the beneficiary or physician surveys that you can find in your chat. Thanks again for joining our webinar today.
Awesome. Thank you, Diljit. Diljit's going to be taking over the helm of president in another year of this organization, and I think we'll be in great hands. That was indeed some powerful testimony, and you can see why it's so important that we get these surveys filled out to everyone we can. These stories are heartbreaking and infuriating. Now, we're going to hear from some of the seniors about the dangers that Medicare Advantage poses to them. So I'd like you to welcome Dana Simon and Julie Schwartzberg from the Cross Union Retirees Organizing Committee in New York City. We'll turn it over to you, Dana and Julie. And I think Dana may be going first.
Yeah, Phil, before Dana goes, we just wanted to tell everybody that 250,000 of us in New York City were put into one of these plans. We didn't even know about it. We weren't told about it. And we have been fighting it ever since. And we knew that it was scary and depressing and frightening to have to face all these denials, all these delays. So it was a horror, and I hate to introduce some of these very sad stories. And one person who has been working with us is Dana Simon. And she, out of many people we talk to every day, Dana has a story to share with us.
Hi, thanks, Julie. Does everyone see me on the video here?
We sure can.
See you, Dana.
Okay. Hi, you hear me? Okay. Hi. Hi, everyone. My name's Dana Simon, and I'm a retired librarian who worked for New York Public Library for over 20 years. You may not know this about me, but I have both a hearing and vision loss, which is progressive and gets worse over many years. My hearing declined so much that I became a candidate for 2 cochlear implants and was scheduled for surgery. Getting my second implant, this is when I started to run into problems with my managed care insurance company. The night before my surgery, I received a phone call. My surgery was canceled. How could this be? I had done all the tests. My doctor tells me the insurance company said my surgery was experimental, even though cochlear implants have been successful for many, many patients. Okay, now I've got to appeal. My doctor tells me the insurance company is using data from over 20 years ago to back their claims. My doctor, who's a very esteemed doctor from NYU Medical Center, he's the director of ENT and a not-for-profit organization, helped me fight my appeal. The insurance company fought every step of the way. We went all the way to the New York State Insurance Commission, where 3 doctors ruled that my surgery was indeed necessary. and I received my cochlear implant. Yay!
Thank,
So,
thank you, Dana.
okay, well, I'm almost done. So anyway, um, but this was very stressful and took many months. This is what happens when some surgery is denied or delayed. Some people won't get all the help I got to fight the insurance company, and they won't get the medical care that they need. I, as a New York City public service retiree, don't understand why New York City is trying to force public service retirees into an Advantage Care Medicare plan. Advantage Care is not Medicare. It doesn't cover all the services that Medicare covers, and denies and delays and uses out of network to prevent people from getting their care. Advantage Care just wants to put patient care over profit. They just want to get richer. Thank you.
Thank you, Dana. And Dana and I have been, and many others have been fighting this painful situation. And now I am going to read to you some other very painful stories from the PNHP survey that was done recently. And we hear these stories endlessly, and everyone who's on here who's a retiree and being pushed into Medicare Advantage will tell you that. So I hope I don't cry while I read these, but here are some of these. I don't take medications my doctor wants me to take because of cost. It's hard to find generics in MA formula, which changes every year. No reputable dentist will accept MA dental, so I pay out of pocket. Haven't been in 4 years. I also pay out of pocket for most of my vision care, and I'm ignoring hearing loss because of cost. That's just one. Here's another one. I had to take out half of my IRA savings in order to cover copays and fees associated with colonoscopies, in parentheses, colon cancer, and cataract replacement, in parentheses, couldn't see. I did this in desperation because there is nothing left to cut out of my living expenses anymore. One on medication. Some drugs are not covered or the cost is prohibitive. One required a $2,000 copay per month. So I applied for a grant, which was time consuming. This happened twice this year. Insurance costs for some tests are in the hundreds, and I only have Social Security for income. I have put off obtaining new glasses and dental care due to costs. And here's another one. It's hard to believe, but it's true. My medication requires labs. Humana in our area just restricted us from using the cleanest, best labs. Now there's a 3-month wait for any labs my doctor offers. Also, Humana reassigned me to a primary care doctor who only works on Wednesday afternoons. I've been waiting more than 2 months for an appointment, no date set yet.
This is really crazy, huh, Julie? It is. It's heartbreaking. I mean, I can't begin to imagine what it's like to be a senior having to deal with this right now. It's inspiring though too, because it makes us want to fight, and that's the kind of movement that we need to stand up to the power of these corporations. I do really want to especially thank People's Action, and they organized 15 actions around the country as well as organize some of our other national allies who are participating in this fight. Groups like Be a Hero, Social Security Works, Public Citizen, and Center for Healthcare and Democracy. And we need more action like this. These actions are incredible. And so we're going to put a quick poll up on the screen to try and understand what actions people here are most excited about. Please take a minute to fill this out, and we'll be back in a few minutes with more details. So here's the poll. And as you're filling this out, we're going to welcome one of our most impactful healthcare champions, Representative Pramila Jayapal, who has a few words for us today.
I'm Congresswoman Pramila Jayapal, and I'm honored to represent Washington's 7th Congressional District in the House of Representatives, where I also serve as the chair of the Congressional Progressive Caucus. It is no secret that our healthcare system is broken. We live in a time where nearly 100 million people in America are uninsured or underinsured, in the richest nation on earth. A time where the average American spends more than $12,000 per year on health care, and nearly half of Americans, both insured and uninsured, hold medical debt. A time where the thought of medical debt is enough to keep people from seeking necessary care, in many cases, until it's too late. A critical piece of our healthcare system, one of the few pieces that actually works, is Medicare, a program that provides care and services to over 60 million Americans and is vital to our healthcare infrastructure. But today, Medicare is under threat. Privatizing Medicare is a terrible idea, period, and one that I will fight against tooth and nail. One of the privatization methods is Medicare Advantage, a program that has consistently let down its beneficiaries and removed agency from their healthcare decisions. It's a profit-driven entity that encroaches on Medicare and our entire healthcare system, aiming to make money off of both patients and the federal government. We cannot let that continue. If we took the $140 billion that Medicare Advantage plans are overcharging the government, we could reinvest that money into traditional Medicare. We could afford dental and vision. We could eliminate copays and deductibles, or provide a huge number of other benefits that would support the health care of seniors and those with disabilities instead of subsidizing the profits of private insurance companies. Private insurers are misrepresenting Medicare Advantage, and we've seen a concerning increase in the number of people enrolled in these plans. In fact, more than half of all eligible beneficiaries are now enrolled in Medicare Advantage. But Medicare Advantage beneficiaries have to deal with restricted networks, with prior authorization, and algorithms deciding their care rather than their doctors. And that's why I'm fighting back in Congress. In February of this year, I led a letter with Representatives DeLauro and Stachowski, totaling 70 members of Congress, calling on CMS to implement reforms to Medicare Advantage. As inappropriate care delays and denials with Medicare Advantage harm seniors and those with disabilities, CMS needs to stand up and take action to protect patients. This letter is just one of many that I've sent urging the administration to eliminate the barriers to care caused by Medicare Advantage plan policies, to stop overpayments to Medicare Advantage, and to reinvest the savings of time and money into real care for Medicare beneficiaries. None of this work would be possible without the help of organizations like PNHP. Your advocacy from the outside has been incredibly vital, and your recent report on overpayments has brought light to how much money the federal government is losing by subsidizing these private Medicare Advantage plans. Work like this gives us the data that we need to make the case that Medicare needs changes to defend patients and save them money. Healthcare is a human right, and I will fight to ensure that everyone has access to the quality care they deserve. There is still so much work to be done to ensure that seniors and people with disabilities are protected from the greed of health insurance companies. We need a national movement to protect and improve Medicare. And your action as doctors, beneficiaries, and advocates is absolutely crucial in that mission. So thank you so much for your work, your activism, and your dedication to this issue. And as you continue, please know that I'll be fighting alongside you in Congress every step of the way.
That is just so inspiring that we have a representative in Congress with, who is fighting for us to address Medicare Advantage and promote improved Medicare for all. I'm going to ask Julie Schwartzberg. Julie, can you come back on video and come off mute? And I'm going to have you in just a sec tell us a little bit more about some of the actions that we're seeing around the country around this. Tell us a little bit more about that. But before you do, I want to tell everyone that we hear you. We are definitely going to be sending out an email tomorrow that will have all the links. So just in case you're not able to access them right now or copy them, we will send out a follow-up with a recording of the webinar, as well as with all of the links that you're seeing in the chat today. So you will definitely be able to follow up on all of this. And now, Julie, I'm going to send it back to you to tell us a little bit more about what's been going on in the country in this fight.
Thank you, Phil. And let me bring some good news. There is a terrific fight going on against this all over the country. And we in New York City have stopped the city of New York for now from putting us into this horrible plan we don't want. And what we'd like to do right now is share with you some of the actions that we did in the street with elected officials, with people all over the city who were supporting us, to let people know. Half of the retirees didn't know that was happening. And certainly people have not. So the education is out there. People are jumping in and supporting us. And we just want you to see a little bit of that you can win and what we've done.
You better think about what you're trying to do to me. Think, let your mind go, let yourself be free. Let's go way on the way back when. I didn't even know you couldn't have been too much more than 10. I ain't no psychiatrist. much more than 10. I ain't no psychiatrist, I ain't no doctor with degrees, but it don't take too much time to see what you do.
Well, if that's not good enough, I wanted to share with everybody another little slideshow and let everybody know how exciting it is that there is a national movement. We are so excited. This has been 2.5 years of working on this, and there are actions all over the country by wonderful, wonderful organizations. 12 care over cost actions were held last week, sponsored by People's Action. This one is in Chicago. There was a die-in they did in the lobby of the Blue Cross Blue Shield office. And they did a rally outside. Denied. Another action was in New Hampshire, focusing, these were all on the insurance companies and their greed and ripping us off. That was in New Hampshire. Here's a biggie in Hartford, Connecticut. The Aetna national offices, Aetna, who is trying to get our health care in New York, but they're not going to get it. This took place at the headquarters and was organized by Connecticut Citizen Action, Be a Hero, and the New York City Organization of Public Service Retirees. Yes, they're glad we were here. There was another one in Maine, again, focusing on Aetna, which is one of the biggest ripoffs. It was sponsored by the Maine People's Alliance. And it's amazing that this was going on all over, in St. Louis, in Rochester, and other cities. And then there's the wonderful organization in Washington you should all know about called PSARA. And they have been fighting this in wonderful ways for years. And they had a Medicare anniversary celebration where they told people that, yes, the merchants of death are really who they are. And then Be a Hero did with other organizations, did a fantastic event in Washington, D.C., and had famous politicians speak, and was well organized. And the last thing is that there is a national alliance for retiree healthcare being organized by retirees all over the country are being put in this situation. There are many states involved. If you are in a state and you are a retiree who would like to join, or your organization would like to join, please email us or drop in the chat, National Alliance, and your contact information. We will get in touch with you. And I want to say we should be so proud that there is this national movement and we are going to win.
That's just fantastic. Thank you so much, Julie. Honestly, it really is inspiring, right? You know, so much action that people are taking to stand up, to fight for, you know, the elimination of this profiteering in Medicare Advantage and really, you know, improving Medicare, improving healthcare for all of you that depend on it. So, you know, this is just, I think, a really inspiring moment. And so now I'd like to introduce you to one of our past presidents, Dr. Carol Paris, and she's going to say a little bit more about some of the concrete action steps that you can take moving forward to protect patients, to protect Medicare from these insurance companies. So, Carol, take it away.
Thank you, Phil. As Phil said, I am a past president of PNHP and on the advisory board. And perhaps more importantly, in the words of my former Congressman Jim Cooper, I'm a force to be reckoned with. And it looks like Julie Schwartzberg is a force to be reckoned with. And it looks like from that last set of videos, a lot of you are already forces to be reckoned with. And that's what I am hoping that today's webinar speakers have inspired you, to all of you watching this today, to become a force for the greedy corporate Medicare disadvantaged companies to reckon with. And how do you do that? Well, I would like you to use the chat and you tell us how you are going to take action in the fight to improve traditional Medicare today. Save it from the clutches of privatization and expand it to Medicare for all. It's going to take our collective people power to win this fight. And here are some very specific ways that you can take action. Number one, I really believe we have to invest in the next generation of single payer physicians. That's today's medical students, by making a contribution to the Scale of Fund, which is a fund that supports sending hundreds of medical students to the PNHP annual meeting. This next one is happening next month. The link is in the chat, and I ask you to please be generous. Secondly, you can write a letter to the editor of your local newspaper. Remember, all politics is local, and your members of Congress read their local newspapers. I personally have an op-ed being published in my local newspaper, the Tennessean, later this month. The link for how to write a letter to the editor is in the chat. Third, you can sign and share our petition demanding that Congress and President Biden crack down on insurance companies, full stop. Share the petition with at least 5 of your closest friends today. That link is in the chat. And finally, I would ask you to fill out and share our Medicare beneficiaries survey. You heard some of the comments made by physicians and by beneficiaries who have already taken the survey. We'd like to add your stories to that list. It's absolutely vital for us to get your stories. So please, that link is in the chat as well. And don't worry if you don't get them all right now. You'll be getting an email tomorrow that will have all that information in it as well. So finally, I just want to stress that your action, combined with the actions of all of us, will make this Medicare Disadvantage campaign a success. Things change when we stay organized, when we build people power, and when we keep the heat on by taking action. Let's all be a force to be reckoned with. If you'd put your name in the chat and tell us now what you will plan to do. Thank you.
Thank you so much, Carol. I couldn't agree more. We need to be a force to be reckoned with. Let's think about this for a second. There are over 50 million people in the United States who depend on Medicare, and they are all being hurt by these actions. That's 50 million people. Can you imagine if 50 million people stood up and said, we demand something better, right? And so these actions, whatever you can do to bring your friends on board, to bring your family on board, to let your communities know, every step you take makes a difference. because they won't listen if it's just 100 or 1,000 or 2,000 people saying something. But if we can set our sights higher, we can make a real difference and protect seniors. And honestly, we at PNHP, you say, wait, you're not Physicians for National Seniors Health Program. No, we're not. We're Physicians for a National Health Program for everyone. But we regard this as a critical step on the road to Medicare for all. We need to protect the good parts of Medicare. We need to make it better. We need to get this profiteering out of there. And then we need to expand this to everyone. So as we wind things down, I want to take a moment to just thank all of our speakers. Whether it was Dana or Julie or Carol or Ed, or any of the folks that we've heard from, Diljit, from Dr. Mayer. It's so helpful for us to hear that. Now we all need to take action. We just showed you how these insurance companies are getting $140 billion in extra money, and they are not going to give that up. We need your action to protect Medicare. Together, we will win better healthcare for everyone in this country. And so again, continue to drop some of your comments in the chat. We will be sending all of the links out tomorrow. We'll send out a recording of this webinar. And I'd last like to thank our PNHP staff for helping us put this thing together. You guys have just done an amazing job answering dozens and dozens of your questions. We need your help. We need your help to protect Medicare. So please take action. Join us in this fight. And again, together we will win better healthcare for everyone in this country. Thank you again so much for taking an hour out of your day and spending it with us. I think this has been really exciting, but these are just the first steps that we need to take. So y'all have a safe day. Thanks.